Good morning, Dr. Phil.
Good morning, Principal Phil HAWKE.
Yeah, so today I have Dr. Philip PINGA here with us. Dr. Phil is a GP at the HAWKE Private Hospital, and he is one of a number of people that we've been interviewing around the development of COVID-19. And Philip, you had a particularly interesting time because now we're smack in the middle of winter in HAWKE. So thank you for coming here. I hope you enjoy the fresh air, the view of the mountain, the sound of the children. Authentic experience, I hope, for you of a school.
Oh, yeah.
Excellent. So Philip, if I can ask my first question, we do now have a number of positive COVID-19 patients in our St. Patrick's community.
Yes.
Children, parents, employees.
Mm-hmm.
You get sick, you go get tested, and your test comes back positive. What happens next? What should happen after that?
Okay. What should happen is, according to the new guidelines, is that a person should then self-isolate for 10 days. If they are asymptomatic and have mild symptoms. If they have symptoms, they should then contact their healthcare worker to then get symptomatic management and treatment for that. Then there's a different group of people who have what we call moderate to severe disease. Those are people who probably then need to be admitted to hospital. Possibly some of them need oxygen, and a small number of them may need critical care. Now those people, the guidelines stated that once they've stabilized, and usually their doctor will tell them when they've stabilized, depending on whether they needed oxygen, whether they needed to be in a critical care unit such as high care, ICU and so forth. They then need to self-isolate for a further 10 days.
So when they come out of hospital, another 10 days.
Another 10 days of self-isolation on discharge treatment. And then I would also add that they possibly need to then go and have a review with their doctor. I know within our practice, we are then asking people to come back and see us within 2 weeks to see how they're doing, and to then...
So that is that group who have been hospitalized?
Yes.
The critical group?
Yeah.
So not everybody?
Not everybody.
Just that group?
Just that group, yeah.
Okay. Well, thank you for that, Philip, because you've drawn a clear distinction here between on the spectrum of not so sick to very sick.
Yes.
And that affects how many days you go into quarantine.
Yes.
Yeah, okay. There has been a question in our community several times, if you're mildly symptomatic, should you stop exercising?
Yes, you should stop exercising. Now, again, we're going to differentiate people into groups.
Yeah.
The cardiologists and sport cardiologists around the world at this point in time don't have a clear-cut guideline as to who should stop exercising and when, but however, taking it from other viral illnesses is that people who are asymptomatic to mild symptoms should stop exercising for at least 2 weeks.
Yep.
And then there's a group of people who, if they are assessed by their doctor, now this is especially your sort of high performance athletes, people who take their exercise very seriously. If there's the suspicion or on lab evidence of what we call myocardial injury, so injury to the heart muscle caused by the virus, those people are then expected to go back and be assessed by their doctor, and then as well with them should wait a further 2 weeks before resuming exercise in a graded manner.
Yeah, like light exercise.
Light exercise going forward. And I cannot stress how important it is with any viral illness to stop exercise, because it's not just COVID, it's also the common flu which draws risk to the myocardium, the heart muscle, in relation.
I'm glad that you've highlighted that, because I find a lot of people, just my own experience, probably go back to exercising too early, and they expect to just sort of pick up where they left off, and in fact it's damaging. So that's very good advice. Phil, just to swap a little bit, is it okay if you do fall ill but you're not that ill, you kind of just it's mild symptoms, can you go and self-medicate with paracetamol type medicine, or given the circumstances at the moment, is that too risky? Should you actually go and see a doctor?
If you test positive and you're mildly ill, and you need something possibly for minor aches and pains, it's all right to self-medicate with paracetamol in particular. Avoid anti-inflammatories, avoid pain medications that contain multiple ingredients. It's all right to use vitamin supplementation. I also encourage people to get out into the sun when it's physically possible and tolerable for them to do that, because we're slowly learning that things such as vitamin D, which we actually produce when we're in the sun, is advantageous to dealing with the disease process of COVID. But the things to really watch for is really aches and pains that leave someone debilitated, getting out of breath with very little effort or whilst seated or lying in bed, feeling chest pain, continual chest pain, an uncontrollable cough, and generally people, and a lot of times you'll see this sometimes with older people, they just flat, the person may not cough, but they just not themselves, then definitely go in and seek help.
So don't try and self-medicate under those circumstances.
Under those circumstances, do not try and self-medicate.
Phil, just I'm not sure whether these kind of stats are available, but I'm sure they are starting to come out. I mean, what percentage internationally, what percentage of people who test for COVID-19 actually fall in that group that you defined as critical at the beginning of our conversation? Were we talking about 5%, 10%?
In terms of people who will need specialized care, according to the World Health Organization, currently, you're looking at about 1 in 5. So you're looking at about 20%. And that fits into the other statistic, which is 80% of people who contract COVID will recover. So then it leaves that 20% who are at risk and will probably need specialized care, and then there's a lower percentage of that who would probably go into critical care, and somewhere less than 5% of those people would probably then need ICU setting, life support, ventilatory support. Yes.
Let's just talk about that 20%.
Yes.
Who are they and what are their characteristics?
At this point in time, we are looking at people with comorbidities, so chronic illnesses that in particular we're finding affect the cardiovascular system, being the heart and the blood vessels, so high blood pressure, diabetes, cardiac disease, and cardiac blood vessel disease, which is sometimes ischemic heart disease, and people with chronic kidney disease. And then we're also finding people who are what we call high BMI, people who are obese, particularly people with a BMI above 40.
And they're also probably type 2 diabetics.
They
Good
are,
chance.
they're in one of two settings. They tend to be what we call pre-diabetic, or sometimes they fall into metabolic syndrome, where they've got a couple of other abnormalities that don't fully define a particular disease, or they are diabetic and they don't know it.